For you this morning on Daybreak, researchers at Mayo Clinic are learning more information about who is at a higher risk of getting COVID-19 among the younger population.
KIMT News 3's Madeline Watkins spoke with the lead researcher about what they're calling the Rochester Epidemiology Project and the results it's showing. She joins us live now. Good morning, Madeline.
Good morning, Brooke and Tyler. We've known since the beginning of the pandemic that people with underlying health conditions are at a higher risk of getting COVID-19. But what this study shows, conducted by researchers here at Mayo Clinic, is that younger people with specific health conditions are at a far greater risk than their older counterparts. So this is Jennifer St. Sauver. She's a professor of epidemiology right here at Mayo Clinic. She tells me people younger than 45 had 3 times as great of an increased risk of severe COVID-19 if they had cancer, heart disease, or blood disorders, whereas the risk of severe infection in older people with those same conditions was far less likely. She says the point of this research was to help the public better understand the trends in their community.
One thing with any disease and condition is it's going to vary a lot from place to place. And if you want to improve health or really understand how to prevent diseases, you need to know what's going on in your region so you can focus in on the things that will help make your local population healthier.
She tells me that the findings from this study could be playing a role as to why younger people are becoming more hospitalized with COVID-19 across the nation. But of course, vaccine hesitancy still remains the #1 reason. Live in Rochester, Madeline Watkins, KIMT News 3.
All right, Madeline, thank you. Researchers studied nearly 10,000 participants and found race and ethnicities also played a role, with Asian Americans having the highest risk of severe COVID-19 infection, followed by Black Americans.